Hello and welcome to another edition of a live webinar here at the VDA. We're excited today to have iCore Connect with us to understand the new Virginia e-prescribing law and how your practice can benefit and save with iCore RX. We are excited to have with us our partners in helping bring you a solution to the new e-prescribing opioid law that is going into effect come July 1. A little way of background there, and then I'll introduce our speakers who are joining with us today to help us learn a little bit more about the platform. Effective July 1, in a bill passed in the 2019 General Assembly basically just says that any opioid prescription must be done through electronic means. So that means no longer can you write a handwritten prescription for an opioid, and it also includes you cannot do a facsimile to prescribe that opioid. Going into effect is July 1. We are trying our best to give you a solution to that, and we have with us today iCore Connect President and CEO Robert McDermott. Pleasure to have you with us. Robert is President and Chief Executive Officer of iCore Connect, an award-winning provider of secure communications and productivity software for high compliance industries. He brings over 30 years of technology industry leadership and executive management experience to his role leading the company's innovative team of software developers, sales and technology experts, and additionally, iCore Exchange HIPAA compliant email, which we are also a partner of at the VDA, was named one of the Dental Product Report's top 50 products of 2017. We're excited to be a part of that as well. So thank you for joining us today, Robert. And we also have with us David Fidenza. I appreciate you joining us today. He's the Chief Information Officer as the CIO at iCore Connect. David manages the IT department as well as the support and implementation teams, and he leads efforts to continuously improve products through strategic business partnership and customer input. Over 30-year career in the industry. So we have two fellows with us today who absolutely know what they're talking about, and we're happy to have you with us. So welcome.
Thank you.
Thanks, Ryan. Appreciate it.
We'll go ahead and dive in with our Q&A session and get to a little bit more information and background here about iCore Connect and the iCore electronic prescribing that we are excited to talk about today. So Robert and Dave, thanks again for joining us. Robert, the VDA Services selected iCore Connect as an endorsed partner for two of your services. In 2015, we brought on iCore Exchange, the HIPAA compliant email. This year, iCore RX, which we're here talking about, e-prescribing with optional PMP aware integration. Would you mind giving us a little bit of background more related to iCore Connect and iCore Exchange before we dive into the iCore RX?
Certainly. So iCore Connect is a cloud-based software company focusing on technology and productivity workflows. We are 100% cloud-based, all of our products, and we've been serving the dental community now for 7 years. Our iCore Exchange is another endorsed product for the VDA, and that is a HIPAA compliant email, also cloud-based, no file size restrictions, audit trails, and we also use what's called a direct protocol in our email, which is probably the safest form of transfer of data between doctor to doctor, because you are a known entity if you're on direct. So free communication inside the network, outside the network, and really the big thing is no file size restrictions. And we use the highest level of encryption as well. That's out there today in the current market.
That's great. There's a lot of need for that encryption and need for security. So I know we have heard recently of a lot of concerns around that and issues in other states nearby that have had some real unfortunate incidents, and dental offices are not immune to it in any way, shape, or form. So I'm glad to hear that. We know, we're here to talk about the Virginia July 1 deadline for e-prescribing for opioids. We have an opportunity here to talk about a whole litany of things other than just that, which is the exciting part. And I know that y'all have been talking to Virginia dentists and doing some running through your product with them. And I think a lot of them have been excited to see that there's more than just the prescribing part, which is exciting. So Dave, how is the e-prescribing workflow different than paper, phone, or fax?
Yeah, that's a good question. So if you think about it, at the root of e-prescription, the workflow is very similar to the way people work with paper today. So generally, the doctor wants to prescribe something to a patient. So what they'll do is they'll tell the front desk to stage the prescription pad, write it up, get everything ready. The doctor will walk up, take a look at it. If it looks right, they'll sign it and hand it over to the patient on the front desk. So electronically, it works a lot the same way. The staff can actually come in and stage the medication or the prescription for the doctor on their behalf. And then what it requires then is the doctor to just look at what the prescription says and then transmit it out. And that's basically the electronic signature versus the handwritten signature. So again, what you're looking at, the workflows are similar. One is just manual paper versus electronic. But then beyond that, it gets a lot of added benefits, because now if for some reason the doctor needs to be remote and they need to be able to write a prescription, they can do that from anywhere because we're cloud-based. And the patient information is available within that, so they're able to do that. Additionally, you can communicate with any pharmacy in America without having to try to find the pharmacy, or what used to be in the past was a lot of requirements to find out who those local pharmacies. Well, there's a national database of all the pharmacies that you can easily select from and send to anywhere you like. So whether the doctor or the patient is remote, you have a lot of flexibility, but the workflows are very similar, just one is electronic versus paper.
I know that we've actually, the folks that have already met with y'all and gone through the presentation, I think a lot of them are very excited that the workflow is going to open up for them. I mean, now they can do it remotely and have that login from other than just their office, which is pretty exciting. So Robert, you have recognized and saw the future of e-prescribing maybe long before others did, and been a big advocate for it. Why have you been such an advocate for e-prescribing?
Yeah, so there's many reasons, Ryan. One, it's cloud-based. So many of the systems today for the practice management are still server-based, which means they either have to access it at the office or through a VPN. So this is cloud-based. Anywhere you have an internet connection, you can connect to our e-prescription software. The other thing we're trying to do is help curb the opioid crisis. And with our software and e-prescription software, we are able to provide a drug history of that patient, even if it's the first time the doctor's seeing that patient. So there's no drug-to-drug interactions, allergy interactions. This all gets eliminated, and it saves that as a digital copy to the patient file. So one, it's HIPAA compliant. You have an electronic trail. There's no transposing of numbers, milligrams. There's also things like a lexicomp directory in the e-prescription, which gives an entire listing of the drugs, milligrams, infectious disease, patient education as well. So there's many, many advantages, I believe, to being on an e-prescription software. And we'll get into other features and benefits that we think will enhance it as well. But it also has the ability to integrate with the PMP state website. So we have found that it takes approximately 5 minutes and 40 clicks or 40 plus clicks to get through that for the patient. We've actually connected to hundreds of practice management systems. And with a single click, we can pre-populate that state website and make the doctor really productive and get all of the information that's available, and also at the same time meet the state mandates and laws.
Oh, I know you mentioned a couple times the cloud. You know, I am not a computer expert, and I am certainly no programmer. I know how to use one, and I enjoy them very much. I'm thankful for them. But can you help us, you know, explain to folks exactly what it means for something to be in the cloud, demystify what it means to be to have that information and all that data stored in what's termed the cloud?
Yeah, so that's a very good question, Ryan. I do see credits, you mentioned them earlier, throughout the country, and I always get that question. The cloud, it's a mysterious thing out there. So really, at the basic of it is the server is in our data centers versus at your office or under the desk or somewhere in your facility. It's actually in our data centers with redundant backup. We have 3 data centers that it's real time. So it's really not any different than you're doing it now. If you have a Gmail or a Yahoo email account, you're actually using the cloud. And so I always say in my CE courses, who is in the cloud, maybe 10, 20% of the hands go up. And then I say, who has a Gmail or a Yahoo account? All the hands go up. And then I say, well, you guys are using the cloud. You just don't know it yet. So that's really the mystery solved right there.
Well, as we start to talk about iCore RX, Robert, what types of medications can you prescribe through the iCore RX?
Yeah, so this is an important factor, I think, because I speak to hundreds of dentists in Virginia and other states as well. They think it's just controlled substances, and it is not. You will and can prescribe all medication through our RX software. So you can also, in addition to the controlled substances, you can prescribe amoxicillin or anything that you're presently doing. And the advantage is, again, it goes into the patient medication history. You're able to access that patient medical and drug history. And again, you have that lexicon directory that you can educate the patient and educate the doctor as well.
Well, thank you. Yeah, absolutely. And Dave, that we know that there are a lot of different types of drugs out there. How has your team simplified the search by all the brand names and or generic names to help the doctors out there?
Yeah, that's one of the things about our system is it's tied into the National Library of Medicine. We use what's called RX Norm, which basically is the categorization of all medications in America. And we can prescribe from the system any form or type that's available to prescribe in America today. They can search by whether it's the brand name or the manufacturer's name, and there's cross-reference to that. It'll even show discontinued drugs as well. So that would let you know that if you were looking for something that maybe was recently discontinued, it'd actually show it to you. Wouldn't allow you to prescribe it, but it might show you what the other brand name is today that is prescribable, that's similar in chemical makeup. So anything that you can prescribe in America today, you can prescribe through e-prescription.
And Dave, I'd like to add that you don't have to know the entire name of the medication as well. So it does have a keyword search.
Right.
So if you start AM, it'll start pulling in all the medications that begin with AM.
I know that dosing is an issue. You and I have talked offline, and so I've learned quite a bit about the benefits of what iCore RX can bring far beyond just meeting and complying with the July 1 deadline. But understanding the dosage, the patient history, drug interactions, all of those things are things that I know y'all have as a benefit of this that you do not get when you write it on a piece of paper or send it through a fax. How have y'all addressed that, and how does it help the dentist in understanding all of those factors?
Well, as Robert mentioned earlier, there's a direct link to Lexicomp, so immediately they can dive in and do drug research right there, which has all dosing information. However, even on just a basic lookup, the general lookup, you immediately get normal dosage in front of you, presented to you for that medication. Additionally, it will warn you in case you're out of what's the recommended dose range. So if you were trying to give somebody some milligram equivalent above what's normally prescribed for an adult or a pediatric, it'll actually come up and say and give you a bit of a warning there. So it allows you to make those changes before you do that. So again, without this kind of feedback, whether it be drug to drug, drug to allergy, dosage information, and even pediatric calculations within here as well when you're working with different types of medications, all that information's available to you. And as you mentioned, it's not available on paper or facsimile. The doctors would be the one that had to research the medications to know that what the interactions are. This system does it for them. And when you start talking about the amount of medications out in the world today and the potential interactions with so many of them, this type of information that's automated can be very helpful and better, obviously, for the patient and the practice.
Yeah, that's absolutely phenomenal to be able to also see all the previous prescriptions for the patients and the drug interactions and how things interact with one another, and knowing what other prescriptions that patient may be on is just, unbelievably useful and beneficial to making better decisions. And at the end of the day, that really is what we want to be able to offer our members. So I appreciate you elaborating on that. Do you have anything?
Brian, I'd like to add something if I could. There's been many surveys out that say that if the patient has to wait at the pharmacy for more than 5 minutes, they do not pick up their prescription. Mulling around the Walgreens or the CVS and then leaving because they're getting frustrated because they have to wait. So I think that's another huge advantage, because that's what the doctor prescribed. We want the patients to take what the doctor is prescribing.
Well, that's fantastic, because now it's and also a benefit to the patient, not just to the doctor.
Absolutely.
Obviously, it's anytime you can have more information, make a better decision, get more feedback. I think I've heard enough to know that that the dentists and doctors always are looking for an edge to have quicker data to make a really solid decision, and this really gives you a whole lot more than you would get through paper or fax.
And they can access it 24 hours a day.
Yeah,
as well.
Absolutely.
I just spoke to a practice this morning that said the doctor can't access anything from home. Will he be able to do that with your iCore RX? And I said, absolutely.
That is really cool.
Yeah.
And Robert, we talked a little bit, or we talked about practice management systems earlier on, and we just kind of mentioned it, that iCore RX's interface. Can you go into a little bit about how well that does mesh and the interface works?
Yeah, certainly. So we integrate with many of the current larger practice management systems, Dentrix, EagleSoft, Open Dental. We also built a patient import tool. So a lot of the practice management systems are older, or they didn't see e-prescribing on the horizon, or they just don't play well with others. So we built a patient import tool to help them make their software more productive. So even softwares that currently don't have what they call an API or a connector to somebody else's software, we've built a connector for them, and we actually can export that data and still use our e-prescription software.
That's
so
great.
That's really helpful. The doctors have really given us fantastic feedback on that.
That's fantastic. Working around that lack of the API is really important. So
yeah, and because we are the developers of the software, we develop all our software with a manufacturer, developer, and service provider. So it's a little easier for us. We're not reselling somebody else's third-party product. So it's we have a full development team in-house.
That's great, and it makes a difference when a doctor calls with a suggestion or a or feedback, or it's going to the appropriate place, the one-stop shop, which is fantastic.
Right. And we take that input. We have presently 13 products, cloud-based products for the dental market, and we do take input from the doctors. Most of our software has been built from the feedback of the doctors.
That's great, and constantly, I'm sure, getting better, and that's the beautiful part of having it all in-house, right?
Yeah.
Yes.
The complaint department knows the guy in the software development section of the house.
Yeah.
Right.
So that's great.
I think, Ryan, too, one other thing I'd like to add with that integration, the PMP site, again, the biggest complaint I hear from the doctors presently is that it's cumbersome. They have to type it in, it's manual. How do they save it back to their patient file? Again, so we've done a single-click integration into the state website. So it'll pre-populate. Let's say you're using Dentrix, we'll query that schedule. We'll pre-populate that patient information. When they go to the PMP button, it'll actually connect to the website and pre-populate all that data.
Thought of it as, if you're going to be prescribing controlled substance, you would need to go to the state website. So let's get those two features right next to each other. instead of keeping them separate and just more work for everybody.
Absolutely. Well, I want to be respectful of y'all's time, and also we want to be as succinct as we can. Two parts still left. I want to give y'all an opportunity to clearly, communicate to our members exactly why and how this would benefit them. And we are going to continue to do that as well, because we're excited about the offering. We're making lemonade out of lemons, right? Nobody likes to be mandated and told to do anything. We do understand there's a social responsibility here. The opioid epidemic is a problem. But at the end of the day, we're hopeful that this is opening some folks' eyes to new opportunities, new technology that maybe they were unaware of, and an opportunity to do more with it and find some flexibilities to be able to do things from home. So I wanted to give you all a last word and to talk a little bit, summarize on iCore RX and its benefits. And then I'm going to end us here by kind of explaining our relationship and how the membership can take advantage of it and how much they can save by doing so.
Yeah. So I think to summarize, single-click integration to the state website, cloud-based, accessible from anywhere. And I think another thing that's really not spoken about, and I hear quite often, because I do speak to the doctors often, is the service and support piece. Maybe from some of the other manufacturers and some of the other practice management softwares, we provide live support 7 to 7. And it is a iCore Connect engineer that answers the phone. It's the same guys that help develop the software. So I think that's important. We don't charge a setup fee or a one-time installation fee or nothing like that. There's no registration fee. And one of the other things that the doctors have to do is identity proofing. And we put a customer service support specialist on the phone with them and help them guide them through that process as well. So I think, we're trying to hold their hands through the whole step, all the steps in the process from A to Z.
Yeah, I think if you look at, first of all, I do a lot of demos myself. So I'm actually engaged with the doctors and the dentist in Virginia. And, they come into it with what you were saying earlier, nobody likes a mandate. But once they see the functionality of the system and the benefits that we've gone over here, they start loosening up a lot more, because instead of, simply just another way to do something they've done before, which just consider that we're actually adding a lot of benefits here that they like. And when you look at the big picture, and you had talked about the social responsibility, consider that, aside from opioid abuse, there's a lot of people that have poor reactions to medications, and they're taking them just as prescribed. So by giving the doctor information that they would have to otherwise study, and know for themselves, or go in and research through lexicon themselves, the system automating that process, and they start seeing the benefit and the power of that, they come out of the demos with a completely different attitude. And so we would say to you that take a look at it. You can set a demo up on our site. We'll take you through it live and answer any questions that you have right there. But I think once you get a look at it, you'll feel a lot more comfortable with and see the value that comes with e-prescription.
Yeah. And Ryan, I'd like to add too, this is senior management here in the company, and we reached all the way down to the local practice. We speak to the doctors. I spoke to 2 VDA members last night after 9:00 p.m. So I don't know if you can get that kind of service in other places, but we certainly, that is our company mandate to touch the end user, find out what they need and build it.
That's great. I mean, that's impressive and not something you get very often. And I can tell you from the feedback we have gotten from member dentists who have gone through the demo, and they genuinely, I think exactly like you said, have changed their perception of being forced to have to do this from a mandate standpoint to now looking at it as this could really benefit my practice, make my life easier, and also honestly make me make better decisions and some protections against making some mistake or something that's out there. So it is technology that is going to provide people with an upside. So that's why when we started this conversation with y'all about a year ago, I guess, gearing up for this date, we've been excited to partner with y'all, and we are excited to be able to offer VDA members a significant discount. And thank y'all for that, and for recognizing that your relationship with organized dentistry and through the Virginia Dental Association is one that you value. And so we're excited to be able to just pass those savings straight along to our members. And you can save as a VDA member over $550 a year by going through iCore RX as to some other option out on the market. So we're excited about that. That more than pays for your VDA membership in a year. So it's really a great opportunity for us to go show member value and the reason to be a part of organized dentistry. And y'all have a whole myriad of other offerings that we have partnerships with you. And I know for a fact, a lot of them, I've heard nothing but good things about your HIPAA platform as well. So and that is another great offering. So this is just one of them we're talking about, and it already pays for your VDA membership. So imagine if you took advantage of 2 or 3.
There you go.
Exactly. So, but thank y'all so much for your time. If you are interested in going down this road and you would like to set up a demo, feel free to reach out to the Virginia Dental Association and Elise Rupinski, or reach out directly to either of our speakers here to set that up, and we will be happy to share that information. So with that, thank you all for your time, and greatly appreciate the partnership.
Likewise.
Same here.